You're listening to the Confident Choice Podcast with me, Dr. Roberto Garcia, a double board certified facial plastic and reconstructive surgeon. Honest conversations and expert advice about the decisions that make you feel your best. So welcome everybody to the Confident Choice. I'm your host, Dr. Roberto Garcia, and I am honored to have my older brother, the man I've learned so many things from throughout my life, not only from him being my best friend and my confidant my whole life, but also an amazing surgeon who's taught me a tremendous amount in my career, so I'm very thankful for that. We have we've really enjoyed this podcast. So 9th episode now. Last week we had Dr. Pazel. That was fun, talking about surgical and non-surgical options. But one of the things that I've been wanting to cover, and I think one of the things that you and I really forged a path, and I'm going to have you speak more to this because you were the one who really started forging the path of facial plastics in this community. And so I think this is why when I wanted to have a segment where I talked about the importance of specialization, I really needed to have you because you were really that first pioneer, what's his name? Merriweather, who are the two guys that crossed the Lewis and Clark, that's it. Merriweather Clark. Or was it Merriweather Lewis? All right, listen, I'm sorry for my history teacher from high school. If you're watching this, I apologize, okay? But I figured it out at some point and I put it on a test. It was Merriweather Lewis, by the way. Anyway, Merriweather, welcome. And so, so tell us a little bit about when you started, what you found with regards to your specialty. And a lot of people already know this, but I'm just going to clarify. You are double board certified, first in ENT and then facial plastics. So I kind of want to touch on why is it that people go into ENT versus general plastics, and then I want you to, I want you to speak to that, but then I also want you to kind of maybe talk a little bit. You're a history buff, and you know a lot more about the history of our academy, and then I want to know your personal journey of what inspired you to really dig the path for us future guys.
Yeah, well, thank you for having me. My initial first steps were in medical school. I think much like you, when you do gross anatomy and you kind of you enjoy certain parts of gross anatomy. I certainly enjoyed anatomy of the head and neck, and that was my favorite section of gross anatomy. To me, everything seemed so small and precise, and everything seemed almost like the inside of a clock or a watch. Everything just kind of was worked together in synchrony, and it was fascinating. That's really where my original interest started. Then you move on to your clinical clerkships, where you do pediatrics and internship or in internal medicine and surgery and whatnot. And I developed an interest in surgery. I really enjoyed the problems and the procedures that surgeons did. And then you go on and you refine and you start to see what different subspecialties there are within surgery. Otolaryngology was the one that I chose because, again, it gets back to that head and neck element. And that's where my original interest started. And then, of course, you apply for residency, and otolaryngology, as you know, is one of the more competitive residencies to do.
So sorry to interrupt you.
Yeah.
It's in the year that I applied, and probably even there were less people when you applied, there were 270 spots in the country.
Right.
And in the year I applied for fellowship, there was 35. fellowship spots? I mean, it's probably close to how.
Yeah, and out of those 270 spots, you probably have 900 applicants, 1,000 applicants.
The acceptance rate's low.
Yeah.
You gotta understand though, and what learning intricate surgery like otologic ear surgery, right, where it's all microscope driven, you're learning how to be a technician.
Yeah.
Right? The techniques that we use that naturally fell into a more natural surgery for us when we were doing, say, blepharoplasty or things with much finer threads. For us, it was normal, right? Because we had already developed those techniques of working under microscopes.
Correct, and that's one distinguishing thing between us as otolaryngologists or head and neck surgeons is being able to work in that small environment using the small muscles of your hand. And everything is very focused. You're working in a small area, and so you develop those fine motor skills, like you said. And then back to my story. During residency, you begin to develop interests in fellowships, and where I did my residency in the Bronx, we did a lot of facial trauma. There was a lot of reconstruction and a lot of facial trauma. So that evolves into cosmetic nasal surgery, rhinoplasty. And so you want to learn more about rhinoplasty, and the way you learn more about that is by doing a fellowship. And like you said earlier, the fellowships are competitive. You and I both did one of the more sought after fellowships in the country.
Yeah.
And we learned how to do rhinoplasty very well, and then of course you learn aging face surgery and that kind of thing. But the point that I'm trying to make in all of this is the fact that you gradually hone in on the specialty, and you only focus on that specialty. You don't do this or do that every once in a while. You are only working in this small little circle of procedures. And like you, we do 8 different procedures, 7 different procedures in the face.
Yeah, but there's something to be said about, I almost feel that surgeons who don't specialize in the face, who are doing surgeries everywhere, I almost feel like it's a disservice and a disrespect to the specialty of the face.
Well,
they're not. Yeah. It's not really taken that serious, and this is something that you and I look at differently, right?
Yeah. I feel like obviously other surgeons, if they are surgeons and they are board certified to do the procedures that they do, that's perfectly fine. But board certification is a minimum. Board certification just means that you have the minimum knowledge base and you've met a minimum standard to do those procedures. What differentiates one specialty from the other is the scope of your practice.
Yeah.
And when you talk about the scope of, and I can only speak to my practice, rhinoplasty. I do rhinoplasty every week. It's a repetitive thing, and over and over and over. And like anything else, when you repeat what you're doing, your misses become smaller and your details become greater. And so because of that, you're able to translate all that, I believe, into excellent results.
Yeah.
And that's where it all happens. It's not that we're necessarily more intelligent or brighter than anybody else. It's the repetitive nature of what we do, and this is all we do. It's just one after another of the same thing, or roughly the same thing.
Well, so you get into practice in North Florida.
Yeah.
What year?
In 2001, I started my practice 3 weeks after 9/11.
Yeah, okay.
October 1st,
That's right.
2001.
Because you were the staggered fellow.
Yeah.
So, what did you? Obviously, there weren't a lot of facial plastics guys doing work.
No, what there were at that time were the general plastic surgeons who did everything.
Yeah.
And then you had some otolaryngologists who did facial plastic surgery. So a lot of these guys did.
They might do a rhinoplasty.
They might do a rhinoplasty every once in a while.
Something.
Yeah, every great once in a while they would do an aging face operation. But mostly they paid their bills by doing otolaryngology, sinus surgery, tonsillectomies, those kinds of things.
Yeah.
So that's where I think when I came into the community, I made a commitment to myself that I was only going to do facial plastic and reconstructive surgery. And it wasn't an easy commitment to make financially, because at the time I was trying to develop a cosmetic surgery practice in the town where I was from, but nobody really knew who I was as Dr. Garcia, the facial plastic
nobody
surgeon.
knew that a specialty called
Correct.
facial plastic surgery existed.
Correct.
I mean, I remember reading an article that back in 1992, 95% of all facial cosmetic surgeries were done by general plastic surgeons, board certified plastic surgeons. And in 2003, they did the same study, and 94% were now done by facial plastic surgeons. Now, I'm going to speak on that for a second. You think about it, that's 180% turnaround in the volume of how things, it's a complete paradigm shift. But interestingly, the reason it happened was, back when the board was created, right, in 1986, right, after that skim milk article.
In 1982, yeah.
82. Sorry. And now all of a sudden, facial plastics as a specialty became prominent at the academic level.
Yeah.
And now every ENT program, not in the 80s, but eventually, over the course of the next decade, 15 years, had a guy trained in facial plastics.
Yeah.
Right?
Yeah.
Because there had been fellowships up until that point, but there wasn't a board.
Right.
And so now all of a sudden you had facial plastics guys in the academic institutions taking on those facial cases, where before they had gone to the general guys. Right. And now the general guys are graduating and they don't have the volume. And now they get into practice and they don't feel comfortable with their practice. They can't do it.
Well, yeah.
Or they feel less comfortable.
Yeah, I think that a lot of that speaks to what you said about the turnaround in the percentage of cases that our specialty does as compared to 40 years ago.
Yeah.
And when you try to explain something like that, it's really not that there's the majority of people in this country are under some sort of mass delusion, and we've been able to delude them into thinking.
No, that's the only thing that existed.
That's correct. So the only other alternative is results, right? The results are really what refers patients to you if you have the best results, and that's how I've been able to build my practice. That's how everybody else in facial plastic surgery has been able to build their practice.
Right.
better results with rhinoplasty, happier patients, they tell other patients, and so on and so forth.
Yeah.
So it's just the progression of the growth in our specialty.
Yeah, and I can tell you that, there has been over the course of years different, and I don't like to use the word, you talk to some of these gung-ho guys in our academy and they call it encroachment into our specialty. Anybody's free to do, I don't have that, I'm not that militant guy. If you do good work, I don't care what specialty you are, you do good work. Yeah. Because even within our specialty, there's guys, and you can probably attest to this, you go to a meeting and you're looking at the presentation and you say, which one's the before, which one's the after?
Many times.
and they got the little Ivy League logo at the bottom or whatever it is, and you say to yourself, okay, well, that's not going to float in the real world. Yeah. And so I have met Dick Webster was a general plastic surgeon.
Yes, he was.
One of the best in the game.
Well, he was the first president of the American Academy of Facial Plastic Surgery, but Dick Webster was an interesting guy because, first of all, he was a very gracious guy. Dick Webster was a plastic surgeon from Boston, and he was a very gracious individual. He brought in people from all different kinds of specialties, or he brought in otolaryngologists and some of the people from our lineage. Yeah. He brought in people from our lineage into his practice to teach them how to do facial plastic surgery. But that was an exception in the world of plastic surgery. Yeah. There were really no other Dick Websters out there. He was truly a gracious person, but
with regards to sharing knowledge.
With regards to sharing knowledge, right. The academy, like you said earlier, was born out of the board was born out of a $1.5 million lawsuit that Jack Anderson, one of the pioneers in our academy from New Orleans, won in a libel case against two general plastic surgeons in Atlanta,
right,
who posted a series of articles in I think
some kind of Georgia magazine.
Yeah, and it might have been the journal for the Georgia Medical Society or something like that.
Yeah, in my office in one of those rooms I have it.
Yeah, and so they basically they took a position that anybody who wasn't them was not real milk. Right. It wasn't whole milk, it was skim milk that we were diluted. When in fact you look at the history of facial plastic surgeon all the way back to Jacques Joseph, yeah, who was one of the, if not the father of modern plastic surgery. Yeah. He was an otolaryngologist from Germany who pioneered rhinoplasty. Yeah. Even Harold Gillies, who was an English plastic surgeon, he was an otolaryngologist who took his practice to plastic surgery, but his original training was otolaryngology. And so when you go back to that whole history, it's really all otolaryngology based. Where the division happened is a group of people decided that they weren't going to be inclusive, and this was in the interwar period. And they said, this is our territory and we're not going to share, we're going to create our own board, which was their right to create whatever group they wanted to. But we had to do our own thing. Our predecessors had to do our own thing because we were just as, if not more qualified to do these procedures that we do.
Yeah, in that case, in the court case, they actually brought up examples of, with a brow lift, an ENT is more qualified to do a brow lift because he has done osteoplastic flaps, he's done frontal sinus surgery. With a facelift, they've done parotidectomies for years. With eyelid surgery, they've done trauma, periocular trauma. And with nasal surgery, of course, we've done sinus and internal nasal work. Right. So, in fact, our base, the otolaryngologic base, the ENT base, was better suited for this
cosmetic surgery of the face.
Cosmetic surgery of the face. It was a natural progression. Right. It's not a natural progression when you've been doing bowel surgery for a year and then all of a sudden you're thrown into doing a rhinoplasty, right? Because if you remember, and I do want to get to this point, if you remember, we didn't just jump into rhinoplasty as second year residents, right?
Yeah.
We started off doing septoplasties,
Correct.
and we'd watch a lot of rhinoplasties,
Correct.
but it wasn't until my chief year that I was actually doing osteotomies and moving bones.
Right.
And definitely in my fellowship, you learn more.
Right.
And so that's one of my biggest fears that I have now with this younger crop of physicians that's coming up. They're going to have a longer period of fear. I think every young surgeon, when they graduate from residency or fellowship, has a period of fear. You know, like that. Holy cow! I'm on my own now.
Yeah.
I don't have somebody looking over my shoulder.
I remember those days.
Yeah.
Losing sleep before your
Right. And
face.
you're sitting there like, what if this happens? What if that happens? Whatever.
Yeah.
And so, but you got to realize, we were doing that on the heels of 4,500, maybe 5,000 cases that we had done just in the face during residency. Well, now with all the resident restriction work hours, these kids are graduating with 2/3 of the cases load that we've done.
Yeah, I think that that's inherent in what is coming out of residency right now. I don't think that the way residencies were designed when you and I were in it, I don't know that that was the best way to educate. And all of that, I'm digressing here, but all of that was born from the father of modern surgery in the United States, from Hopkins. There's a big statue of him at Hopkins. I can't remember his name now. Who
I don't agree with that.
Well, that he was a cocaine addict.
No. I'm not saying him.
And he was up at ungodly hours of the day. He wouldn't sleep, and so his residents wouldn't sleep either. And that whole educational system in surgical education was born out of a cocaine
So it
addict.
became very punitive.
So it became punitive, and it became this. It doesn't matter how much you don't sleep or how much you do sleep.
Yeah, but there's the argument, though, and I'm not totally disagreeing with you, but there's the argument that a Navy SEAL is the warrior that he is because he doubted his entire existence in his training, right? That he got taken to the brink
But he
of
got
absolute
pushed. He
disaster.
got pushed to the limit.
And if you don't take these kids and you don't push them and have the fear in there, because right now these residents don't have the fear of being fired.
That's correct. That's something
We had
that
that
we
fear.
had that fear every day.
And every day you went into a case, and if you weren't ready for it, you knew you were going to get blasted. I mean, I remember my 4th year of residency, one of my attendings, Rick Kelly, if you're listening to this, it was you, and who I ended up loving, and he and I are good friends. He looked over at me and he goes, "You might be, Dr. Garcia, the dumbest person I've ever met in my life." And it was only because I didn't know one particular part of this laryngology procedure we were doing. And so you have a choice at that point. And you could say, all right, does he really think I'm really the stupidest? There's guys with IQs of 50. That guy beat me? Or is he just saying it to challenge me, to make me really rethink something and never make this mistake again? And it's obviously the latter.
Yeah. We all know that you have to push the motor to the limit to know what the motor is capable of. I don't disagree with that part of it. The part that to me was the most distasteful part of residency was the hazing and the mental torture side of it. I went through this process, so now I'm going to make you go through this process. I thought that was totally unnecessary, but maybe
your residency was a little bit more malignant.
My residency was malignant. It was in New York City, and it was all in all. I do take away good memories from residency, but that was the way that the educational system was, and you just went through it. And it's a very important point that you brought up, that especially when I was an intern, I every day that I walked into the hospital, you are under fear or threat of being fired, and you don't know. And if you're fired from internship, remember, you're already accepted to residency, which is what you're going to do for the rest of your life. And if you're fired from that internship, there goes your entire career plan, because you're no longer a resident. So you've now got you have to figure out. And I'll give you a quick anecdote. I got called in to the chairman of surgery's office one time because I was late to a conference. I was late because I was taking care of patients on the floor. I mean, I had a valid reason. Somebody was crashing here, and I was late. He saw me walk in late. After the thing, he called me into his office, and I can tell you that I honestly thought I was going to get fired.
Yeah.
And I was convinced this is it. I'm done. And how much good that did to my fortitude and the creation of character, that's tough to say. I don't know, but you're absolutely correct in your assessment about pushing that engine.
Yeah. Well, and look, I mean, and if we were to kind of wrap this up, I do something really cool at the end. I don't know if I've told you this, but we'll talk about it in a minute. But 20 years, 25 years later, okay, now patients come seeking facial plastic surgeons.
Right.
They come seeking the specialty.
Yeah.
And, it's something to be proud of.
Yeah.
It's something to be proud of that, you and I have been steadfast in our commitment to this specialty in this community and in this part of the country.
Yeah.
And, our reputation precedes us really as individuals that were characteristically driven towards a particular model. Yeah. And I think that a lot of that, and this is going to lead me into our last segment, which is perfect. Okay, you guys all laugh every time I do it. This all leads us to lessons that we learn from Dad, And so, Dad died. My dad, I say this every week, but our dad died last year in June 16th.
Almost a year ago.
Almost a year. Yeah. And Dad, Dad loved to teach. Dad loved to talk to us, and he loved to talk to everybody. And along the lines, and I think this is so appropriate for this conversation, was the lesson or the kind of that ongoing message of, in order for you to succeed, you have to fail countless times.
Yeah, that's true.
And the idea, the Thomas Edison concept of the light bulb, right? Failed I don't know how many times.
Yeah.
And I tell patients all the time, I said, the surgeon that I was at the beginning of my career is a completely different surgeon than I am now.
Yeah.
And really not only in the medical field, but in a personal, right? Interactions with my employees, interaction with friends, interaction with family, you learn, okay, that's not the right way to talk to that person. Right. That's not the right thing to say. Let me correct that and let me get a little bit better. But the difference, and Dad spoke about this, you can't be hubris. And when you make a mistake, you have to own it. You have to make a correction, and you have to adjust and become a better person. Because the goal of this isn't a scoreboard at the end of life where God says, or St. Peter at the gate says, all right, Roberto, good job. You won 5,650 times, but the people around you, the world around you hates you. Yeah. That's not how it is. There's no scoreboard. What matters is that as you're going along and you make a mistake, and to our point about our specialty, the details get tighter, right? And so now whenever there's something that you're seeing at 3-6 months after surgery, you can in your mind say, I know exactly why that happened. Sure. Because your window of error is this tight.
Yeah, you pay attention to more details. The big stuff has worked itself out throughout your career, and you pay attention to those little details a lot more, and it makes you better at being more effective and having better results. But if I may say something about Dad, the thing that in your segment, the thing that I still remember Dad telling me is, nobody owes you anything. And I still remember multiple conversations about, when I finished residency, I finished fellowship, and I said, okay, Dad, I'm ready to start my practice. And I remember Dad saying, and now's when the work starts. Yeah. And that's because he always taught me, and you as well, that you're only as good as what you did yesterday, right? Everything can come crashing to an end today. Mm-hmm. And so you have to have the humility to realize that and to understand that you're not owed anything in life, certainly in our field and in our specialty, in our practices. Nobody owes you anything. You have to work every day, and you have to challenge yourself every day, and always be attentive. Never take your eye off the ball, because there's nothing here for granted. So
for sure.
That's my lesson from that.
That's beautiful. That's exactly right.
Yeah.
Well, listen, man, it has been absolute honor having you here. I really appreciate you coming out here. I know you're busy, and this is honestly, this may be the best one. Okay, I know we said that last week.
It's because it's me,
but it's my bro. Sorry, Patrick, but it's my brother, and I do think this one took the cake. So, any of you thinking about watching the Confident Choice, you want to go to this one first. So next week we're going to be talking about. Let me get my card. Revision surgery, and how is it that we accept not the best results, and where do we go as surgeons to that next step? Do we wait a little bit? Do we go ahead and do we intervene a little bit sooner? And how do we plan the proper revision surgery for whatever it is? And folks, I'm going to tell you something. I'll get into this next week. Any surgeon who tells you he doesn't have revision surgeries, he's either lying to you or hasn't done enough of them. That's a fact. And it has nothing to do with the surgeon. It has to do with the way the cookie crumbles sometimes. Results happen. Biology is different between person A, B, C, and D. So we'll dive in a little bit deeper into that next week. And remember, Alyssa's going to get me here. Better decisions make better information. What is it?
Good decisions always come from good information.
Good decisions always come from good information. We're signing out. Have a great week, everybody.